Tampa General Hospital made some news this week announcing a new $50 million deal with Palantir to use Palantir's AI software. To talk more about what this deal means for Tampa General, but also the broader healthcare industry, we're speaking exclusively here with John Couris. He is President and CEO of Florida Health Sciences Center, which includes Tampa General. John, thanks for making the time to chat.
It's great to be with you.
So I do want to dig into the deal, John, but maybe just to begin with, for viewers who are not familiar, just give us the 30,000-foot view of Tampa General, just the history, the place of the institution in the community.
Tampa General was founded almost 100 years ago in Tampa, Florida. We are a 6-hospital academic and research health system affiliated with the University of South Florida and the USF Health Morsani College of Medicine. We have about 700 residents and fellows, over 70 training programs. We conduct thousands of research studies annually, and we are a system that spans across the entire state of Florida.
And so let's dig into this deal. $50 million deal with Palantir. You're using Palantir's AI software. What are you using those AI tools to do, John? What's the problem the technology is going to be solving for?
Well, let me start with what's plaguing the industry. If you look at the healthcare industry, we struggle in quality across the country. There are plenty of great health systems doing really interesting and important work, but as a country, as a nation, we still struggle with improving quality and clinical outcomes and safety. Cost fluctuates anywhere from 17 to 21% of the GDP, depending on the year. So cost has been very stubborn to lower. I believe that AI, both for Florida Health Sciences Center, Tampa General, and for the nation, quite frankly, I think we can increase quality, lower cost, pass that value on to the consumer of healthcare through those types of improvements. And I think AI is a very important tool in that journey.
And so what you're suggesting, you think this deal with Palantir, as you integrate more of these AI tools, you think, bottom line, it is going to improve the care, the experience for the patient?
It's going to absolutely improve the care, the clinical outcomes, the experience for the patient. It's going to do that by making our physicians more efficient and effective, by making our nurses and allied health professionals more efficient and effective, and it's going to help our administrators lead their organizations in a very different way.
And as you sort of use these tools, use this software from Palantir, who's using that, John? Is it your existing employees that you train up? Do you bring in new people?
It's a combination. So mostly it's existing employees that we train up. Think of the work that we're doing with Palantir and AI in general as a way to augment the work that our people are already doing to make them better. Will we be bringing in more people and different people? Absolutely. One of the aspects of our relationship with Palantir is we are going to forward deploy engineers inside the organization itself. So those engineers will be working elbow to elbow.
So these are Palantir engineers literally sitting side
Absolutely,
by side?
Absolutely, yes. Okay. They will be working inside our entire healthcare system, elbow to elbow with our clinicians.
As you incorporate this kind of technology, John, does it change the way you think about running the business in terms of allocating resources, hiring decisions?
When we deploy, or as we continue to deploy this technology, because as you know, we've had a very good relationship with Palantir over the last 3 years. Now we've extended our relationship with them in a significant way. The work that we're doing with Palantir is changing the DNA of the organization slowly in a very thoughtful, pragmatic, impactful way. So no question, is it going to change the way we do our business? Absolutely. Is it going to make us a stronger and more resilient health system? Without question. Why can I say that? Because it's already doing it. We've got 3 years of experience with this work today, and it has made us a better, stronger, and more resilient health system.
So it sounds like, John, what you're saying is, I mean, listen, AI has been traditionally used for drug development. It sounds like what you're seeing is, are you suggesting, looking ahead now, you think there are actually broader, more general use cases for this tech in the healthcare industry?
Oh, there's no question there are broader and more general use cases for this technology. I think this technology, if used appropriately and thoughtfully, will absolutely change the way we deliver care to our patients, the way nurses and doctors engage with those patients. The job of AI from our perspective is how do we make the lives of our caregivers, our doctors, our nurses, our allied health professionals, how do we make their work easier? How do we bring back joy and happiness into the work that they do? How do we build resiliency in the workforce? One of the ways you do that is put important tools in the hands of these clinicians so they can do their best work, eliminate barriers, eliminate obstacles, eliminate fragmentation. And it does just that. In my health system, with the help and support and partnership of Palantir, we have made the lives of the people that are working in that system and the people that we're caring for much better than what it has been. Now, we still have a long road to go. This is a lot of work. I mean, you're trying to change an entire industry, which is one of the largest industries, not just in the country, but in the world. So it's going to take time. Does it work? Absolutely works. We would not have done the deal we just did with Palantir if we did not see the real results from that relationship.
John, I know you're busy today. I appreciate you taking the time to chat. Thank
Absolutely.
you. Thank you.
Yeah, you bet.